Welcome. Welcome to Planetary Health First, Mars Next. I am Michael Mann. I'm the host, managing director of DeSanti. That is my day job, but love doing planetary health. We have some amazing guests. We have Dr. Jennie to my right or to my left, or however you do it. And we have Dr. Z. She's backstage getting all ready, and she'll be coming up. Let's see if we got her. Dr. Z, can you hear us?
I can hear you guys. Hello,
Awesome.
everyone.
Awesome. Well, we are live today on Thursday, and we are live on several different digital networks. So tune in, but most of you probably are on LinkedIn. And we're going to have an amazing conversation today on well-being in the workplace and empowered clinical teams. I'd like to first introduce Dr. Z. Dr. Z is amazing. I don't know too many people that are not just certified, but triple board certified physician in internal medicine, geriatrics, and obesity medicine with extensive clinical and academic experience. Dr. Z is interested in the area of well-being, how appropriate, burnout, mental health, leadership development. She completed a fellowship in leadership education and development certification as a mental health ally and training as a physician wellness advocate. Dr. Z has been recognized for multiple achievements, including Mentor of the Year and the American College of Physicians Young Achiever 2017. Dr. Z is the author of the #1 best-selling book, The 3G Cycle of Life, The Secrets for Achieving Joy, Meaning, and Well-Being. Originally from Peru. That is super cool because Peru, it has the best ceviche, and that is world renowned. I'm going to leave it at that. She's all about joy and meaning. And above or to my left or to my right, Dr. Jennie, she is all about connecting the dots between people, ideas, and new and unexpected ways. She's a clinician, a clinical translator between segments of our complex health system with clinicians, finance, operations, data, technology, research. And she has a strong people skills and bringing psychology into the workplace, and then EQ to complicated problems. And she also is here for us today with Dr. Z. They're going to be just leading it on well-being in the workplace and empowered clinical teams. So who wants to start? Dr. Z, Dr. Jennie, you start. Whoever wants to start. The choice is yours.
I let my good friend Dr. Z kick us off.
I just want to say hi, Jennie. I'm so happy to see you. Looks like a lot of time, but we are very good friends, and we respect each other, and we have been actively collaborating during our journeys as authors and physicians and mothers, and I believe that the connection that we have goes beyond, just being here today, but we have similar goals, and we share similar values, and I believe that it's important to say that because probably some of the information that you will hear from us today will be in some way very similar in context of values and goals. So I said something. Now your turn, Jennie.
No, it's wonderful to be here with Dr. Z. Like she said, we've met each other in a journey to becoming first-time authors, both of us writing our first nonfiction book together in a program which was designed to help folks like us who have day jobs, pretty complicated day jobs, and really want to share a message with the world. So my topic was on the workplace, specifically on the future of work and using my lens as a psychiatrist. So I'm a physician. I work in brain and behavior. So that's kind of my obsession, everything brain and behavior. And so we chat a lot, Dr. Z and I, but Michael, we're here to chat with you and your audience today. And we have a lot to say about burnout, well-being, the workplace, just being human beings kind of in this complicated world that we're in.
So tell us, what is this myth about multitasking? Tell us about that. I mean, we hear it all the time, every time, whether it's Bill Gates or whoever on a talk. Tell us about multitasking. What's the real deal?
So do you want to start, Dr. Z, or you want me to
I just want to say, and you will put the decoration to my message. You will make it a little more elegant. I will say that today, for first time in my life, and I know that multitasking is something that probably is not the best, but I do it all the time. But for first time in my life today, I noticed how dangerous it could be and how embarrassing it could be. When I miss appointments, I confuse people. I realized that I didn't answer emails for months, and I find out that I had a mess in front of me because of the what I thought was my ability of multitasking, right? So there is a real myth about that, and there's something that we need to stop doing because it's affecting our well-being, but it's affecting our performance too, and it's surprising when you realize how how bad quality of work are you offering and how bad quality of life are you offering yourself when you think that you are multitasking. And and now you will bring the scientific part of it.
Yeah, so I tell folks, and I research this for the book as well. If you think you're a really good multitasker, as many women in particular do, I hate to tell it to you, but multitasking is a myth. So your brain does not actually multitask. What your brain does is rapidly shift back and forth between tasks. So if you're multitasking, you're actually just bouncing back and forth. You're not really doing all of those things exactly at the same time in parallel. So I like to cite this study, which I thought was so interesting. Let's say that you're doing one thing. Your brain, your brain uses oxygen, uses glucose. It's an organ. It's giving 100% of effort to that one thing. If you do two things, you're giving about 40% effort to each of the two things, and you're losing 20% to shifting back and forth. If you do three things, you're giving about 20% to each of the tasks, and you're losing 40%. So, in a typical work day for Dr. Z knows how this is, or Michael, like maybe you have email coming, and then you have a Slack, and then you have a call, and then the dog barks, or somebody knocks on your door, or you're internally distracted because you're anxious about something, or multiply this times like 100, and pretty soon your productivity is like down to 0. So it's wildly inefficient and wildly ineffective, and I think what Dr. Z you were saying is that it shows up. Like if you do this enough, you're not really giving a good effort to anything, and you're kind of shortchanging everyone, not just yourself, but if you have patients, you're shortchanging your patients. If you have staff or team members, your family. And so everybody kind of gets shortchanged. And so it's very much in our culture to do this bouncing around. But there are ways to improve that, maybe not stop it altogether. And I think people are shocked when they actually stop multitasking at how quickly they can get stuff done. If you're only doing one thing, I think people are pretty shocked, like, wow, that actually wasn't as bad as I thought it was.
And it's very interesting that you're mentioning that because today, after my crazy morning, right, of a lot of failures, I was actually having a conversation with someone that is very involved in the business world, and I'm sharing this because I thought that it was interesting for me. I have been a physician for more than 20 years, and I have always work in a very structural way. So I thought that I was multitasking, but the truth is that I was seeing one patient at a time, right? And I had a specific slots for moments, and I would have be in a meeting and not in a meeting while seeing patients and things like that. So I didn't notice how structured was my life. Now that I became a entrepreneur, right, and I sat today in front of the computer with my list of emails and the messages and all the things that I have to do. And I thought that I will be able to, or I thought that I was able to do it correctly altogether, right? I discovered today that all the effort of my last couple of weeks was a complete disaster because my brain and the structure of my day was not applicable anymore. I saw that I was able to replicate. And I feel like this is important because adaptability, right? And flexibility. What I recognize today after my morning is that I need to change my schedules. I need to be more organized. I need to block things. I need to set boundaries. So what I am trying to provide is a little of hope. The fact that we cannot multitask doesn't mean that we cannot be very efficient or very successful. It's only that we need to find ways to adapt to our new challenges or our reality, and develop the techniques, the tools, right, and the ways to cope so we can manage our time in a more efficient way, not in a something that will explode in front of us at some moment, right? Because you are collecting these tiny little errors here and there, but they will show up at some point. And in the case of doctors, that's the one thing that we don't want, right? And that's why we don't do it with patients. We don't want to cause any damage to the life of someone, right? But in business, you could be maybe for days without noticing that you are having these hidden errors that you are doing every day.
How do we get better? Like, I heard some tactics and strategies. So, we now know multitasking, the research. I also was kind of curious about, I'm sure there's some studies with, maybe you could just share the how they're measuring the blood flow. That's a side note, but what I really would like to know is what strategies could you help our audience, our listeners, that we can implement to try to get more focused?
I love this question. This is something like, Dr. Z is saying, I practice this every day. I say I wrote a freaking book on this and I'm still practicing, right? Like it's truly a practice. But the key concepts I would say for your audience would be a couple things. So chunking like tasks together so that you don't switch back and forth. For example, I always talk about email. That's kind of everybody's favorite hate topic is email, but it could be it could be Slack or other things too. But if you do all your email and then turn it off, you will be amazed. And that means turn it off, close the window, turn off the notifications, turn off your phone notifications. You're going to be tempted to look. I can tell you, you're going to be very tempted to open it back up, but be regimented about it. And it doesn't matter so much when you do it or how many times a day, but the concept is really doing it all at the same time together. So all the emails get done at the same time together. If you have meetings with people, try to chunk the meetings together, like, 2 hours of meetings, and then I stop and I go do something else. Chunking like tasks minimizes that bouncing around. So that's one concept. And then the other key concept I would say is minimizing distractions. That's kind of like obvious. Everybody knows that, but doing it is hard. So how do you do it? I always like to talk about our tech as like helper robots. Like when the tech is working well, it feels like it's a little helper robot. So, this thing can be friend or foe. It can be a helper robot. The tech, you can actually set up your tech so that it does not distract you, but it takes some intention. So minimizing distractions mainly through tech, but also just your environment. Do you have piles of paper everywhere? Are you looking over in the corner of your office and there's something really distracting over there? Do you have multiple screens up and they're like all doing different things? So, think, you're a human being. You have eyes and ears and a body. So, what's in front of your eyes that's distracting? What's hitting your ears? What's touching your skin? Just think about that. And again, it's a practice to get rid of those distractions. Those are kind of two, I would say, big concepts to minimize the multitasking. but it's really hard. And if everybody else is multitasking, you have a lot of social pressure to do it. And so you have to be very intentional about telling people what you're doing. Like if you're only going to look at email 2 times a day, you can't just do that. People might get mad. You have to say, hey, I'm doing this experiment. I'm only going to check my email twice a day. If you need me urgently, here's how you get me urgently. So you really have to, if you're the boss, you have to share it with your team. If you have a boss, you have to run it by your boss and say, hey, let's try this experiment. So you also have to really over communicate why you're doing these things with other people.
I like the level of accountability too. Kind of like that seems really a powerful way to do it too.
And I would like to add a little of well-being to this combination, right? If you don't mind, but I feel like having appropriate breaks during the day is very important, right? And having healthy transitions from one block to the other, from going to the bathroom as something so natural, right? But maybe using some practice of mindfulness, right? Even when you are washing your hands, or a gratitude moment where you write something nice about the half of the day that already passed, and that give you this moment of reset, right? So you can continue with the other half of your day. I feel that those things have been very helpful for me, especially even in the hospital, or when seeing patients in clinic, knowing that I have these breaks where I can go back to my calm zone, so I can go and see the next patient with a smile in my face and with my mind very clear. Because if not, we are not only physically tired during the day, but we are mentally, and sometimes, depending on the type of job that we have, or the interactions that we have with our colleagues, or how toxic will be the environment, we have an emotional charge too that we need to deal with every day. So with those breaks will allow that this group of tasks that we are doing will have a kind of a flow, right? A healthy flow during the day.
I love that.
So I think really when we're talking about well-being in the workplace and empowered clinical teams, and you're just getting into that, Dr. Z, since this is what it's about, begin unfolding the story of what the healthcare administrators and physicians and teams, what they could do, how they could turn this into a wellness workplace.
Oh my goodness, where do I start? Let's start saying that the healthcare system is broken, is not working appropriately, and is probably the reason why not only the outcomes for patients, clinical outcomes are affected, but also the satisfaction of patients is going down. But this is also affecting tremendously the healthcare workers per se. And I want to bring some numbers just to give some perspective. And I apologize for giving the numbers of the doctors and not including other healthcare workers in this, but statistics are more current and available for doctors. 400 physicians die by suicide every day in this country. Every year in this country, I apologize, 1 to 2 every day. And this is happening before COVID, so we cannot blame COVID. We have, in the last year, 65% of physicians being burned out. We have a 60% rate of depression in physicians. And 11% of physicians that were interviewed in this survey, and this survey included 12,000 physicians, were thinking about the idea of suicide during the last 12 months. And if that is not scary, I don't know what else is scary. Because those individuals that we are describing today, right, like 60% of them being burned out, what we are saying is that they are fatigued, tired, exhausted, that they have low motivation, they can be even cynic about their job, right, and their obligations. And last but not least, probably as important or even more important, that they are less effective in the work that they are doing. So you are saying that you go to an emergency room or you go to a surgery, a neurosurgery, you will deliver your baby, and the probability of having a doctor that is in his best status, physical, emotional, is less than 50%, to be okay. So how scary is that? And that multiplied for the number of patients that same physician is seeing that day, that week, that month. So this is not only a broken healthcare system in the areas of finances and how expensive is the care, how difficult it is to find medications, etc., but we are having healthcare workers that are sick because burnout right now is a medical condition, has been qualified like that have a mental condition, mental illness, and that are deciding about your life or your death, the treatment that you will receive, the procedure that you will go through, you or your kids or your family member or your loved ones, every second. And that's scary. Absolutely.
Wow.
Yeah, and I think, Michael, you ask a good question. So to counter, hopefully, what Dr. Z was sharing, I think a lot of administrators I talk to are looking for like a fix. Like, we'll have yoga, or we'll have mindful Mondays, or you know what I mean? And I think I would offer that the fix is actually easier and harder than we think it is. And the answer is that providers, physicians, nurses, team members, everybody, we are human beings. And if we treat our providers the way we want to treat our patients, it's really kind of that simple. How would you treat your patient? You want to treat your patients with compassion. They don't have to be perfect. If they come in and they say, "Doc, I messed up. I forgot to take my pill one day," you're going to like yell at them and say, "I'm going to sue you for like not," no, we give them compassion. We give them the benefit of the doubt. When we're at our best, we treat our patients with respect and kindness and listen to them, and we treat them like human beings, and we don't make unrealistic expectations. So if we, as administrators, and I've been an administrator, I've been on both sides. I'm practicing for 15 years. I'm an administrator. I've been a national executive for healthcare orgs. So I've seen kind of all the levels. And I think that if we just treat everybody the way we want to treat our patients on our best day, it's kind of that simple. It's less about the money you give them. I really don't believe that doctors or other healthcare providers, I don't really believe that money is their primary motivator, and people may disagree with me. I just don't believe that. Maybe a small number. It's really not. What they do want and crave is respect. They want autonomy.
Mm-hmm.
They want flexibility. And we've, as physicians especially, we put in we sacrifice. I sacrificed my 20s. I didn't go out when my friends were going out.
Mm-hmm.
I didn't have kids until later. All these things that we sacrifice years and decades, actually. And so we come at, I'm not coming out of that looking for a giant paycheck. Yeah. I need to pay my loans, and yeah, I want to have, paycheck that enables me to do things, but I want that respect. That's what I thought being a doctor was about, like helping people, being a healer, being respected in my community, having people say thank you. So I think sometimes the answers are not money, and sometimes administrators feel like it has to be a money answer. And I'm not saying fair pay isn't important, because it is, but sometimes it's less about the money and just being treated with respect and like a human being.
And I absolutely, I agree 300% with what you are saying. And probably the gap is, and I have been also in an administrator position, so I kind of, I understand the other side and their obligations, right, in the other side, but I feel like first we need to start with respect. That I mean, nothing else will happen without respect. That's of course. But I feel like the mentality of those that are in the C-suites, with a lot of exceptions, but I will say the majority that I have been in touch with, they are more concerned about metrics that for us physicians mean absolutely zero. Why? Because they don't change the outcomes of patients. They don't change the feeling or the relationship that I have with patients. Actually, if they change it, it's for bad, not for good, to be sincere, right? So they are more concerned about these steps in the processes and how many seconds you spend clicking the button here and you know, smiling there. uh, they don't care about what happened inside of that room when the patient is crying and is afraid of dying. They don't care about, you know, the hug that you are giving to a husband when lost the baby, or a father that is, you know, afraid because the daughter has a cancer, or who knows. And we are there every day. We are there seeing people suffering, and we suffer with them. And so many times, I personally, I cry with my patients, or going outside of that room and I cry. And that has a value. And that's the art of medicine. And that art is something that administrators do not understand. We are not treating numbers. We are not treating robots. We are not treating livers or bones. We are treating human beings. And there is not a metric for that. That's why we call the art of medicine. And the only way to start improving the healthcare system is probably introducing that chip of humanity, right, to these C-suite leaders, and maybe taking them for a few days of internship with us, putting them as scraps and bringing them to this, you know, to the war, so they can really see what happened inside of these rooms when HIPAA is, you know, not allowing us to share more than what we can.
Are there any CEOs or hospital presidents that make a regular rounds? I mean, it seems like, where are they?
So there are exceptions. So I'll play
There are
devil's
exceptions.
advocate, and I guess I'm, you know, I've been in the C-suite, so I kind of know that side. There are exceptions, of course. I find that C-suite leaders who have been practicing clinicians for more than a couple years tend to get it more because they've been there. If you've only done it a year or something, it's, you know, okay. But if you've been a practicing clinician 15, 20 years, and then you're a C-suite leader, I think it tends to be more in your DNA. What, from my vantage point, what I see the problem is less about the caring and empathy of the CEO, C-suite, which I do agree some of them have struggle with the empathy. But I think there's actually, so what I like to do, my challenge is find that translator module between the clinical team and the C-suite, because I think you're right. The clinical team, like, who cares about a click? Who cares? I mean, they don't care. That's not meaningful. So the translation is, okay, what do the clinicians care about? They care about their patients and how their patients do. So clinical outcomes are important to a clinician. If your patient doesn't have to go to the ER, if they have better control of their diabetes, they're happier, they're not depressed like, I do believe providers care about that.
Mm-hmm.
The problem is more in the translation of that metric into the C-suite and into the finance and the business people and the operations. And so it takes a leader in the middle to be able to say to the clinicians, keep it up. You guys are doing great work. I really, you know, the more you treat this patient, the better their diabetes is. They don't have to go to the ER. Look, you kept these people out of the ER. That's amazing. Like, think about all the quality of life you help for them. So speaking that language to the clinicians, and then turning around and speaking a different language to the business teams. And the language to the business teams is, hey, we kept ER admissions down. We saved $5,000 for each admission times this many people. Look at the return on investment. You did this, you helped your clinicians. Look at this wonderful financial return on investments. Like, so it's the translating between the two so that they're on the same page. And I'm an optimist, Michael. And I'm a futurist. And I really believe that it's that translation piece that is missing. And that's something I am passionate about and try to do. And I think that many of the C-suite folks who seem clueless, if they are spoken to and framed in the right way, they actually can become your biggest advocate. It's just that if you go to them and talk about crying, they just kind of don't, they're like, okay, I get that, but like, what am I going to do? I got to make money, or, and so if you can find a way to connect those two groups, and like I said, I'm an optimist. That's what I do all day. I think it can work, but the first step is the empathy, because if you don't have the empathy, you can't collaborate and work together or find that person who can kind of go back and forth. If it's just very cold and calculated, it's not going to work.
And beyond the empathy, I believe it's also going back to the respect, but it's not only the respect to because, I mean, it's an obvious, basic behavior, but the respect for the fact that this clinician went to medical school for several years, right? And will be able to take the appropriate decision for the patient. And that may not follow the protocols that you want them to follow, because in this specific case, that protocol doesn't work. So, and that comes with the flexibility that you were saying, right? Flexibility, giving us the space for us to be autonomous. So when you feel, and I am doing the devil's advocate today, so that's my role today. I am optimistic too, but I am playing the other side today. But if you think about a C-suite that really does not respect the autonomy, the knowledge, right? And especially the ethics, because when you question my decisions, you are questioning my ethics. You are telling me that I am not being ethic enough, and like I don't have the knowledge to practice medicine. That's what you are telling me when you question me. That's how I will take it. Sadly, and may not be the intention. And again, we need a translator, right, for that. But that's how we take it. So it's an offense, it's an insult. And that's the reason why many physicians, we don't want to talk about burnout, and we want to talk about moral injury. Because burnout, right? Because burnout looks like I fail. I am too weak. I am not resilient enough. I don't take feedback in a good way. I'm collapsing in front of, challenges. I am not made to be a physician, right? I choose the wrong career. And now that we even label this as a disease, right? It's a medical condition, it's even worse, right? So is this a disability now for me? Should I not practice medicine because I am burnout? So this took a direction that for me is very scary, burnout. But when you talk about us suffering from moral injury, what you are saying is that, no, I am a healthy person, a strong person, I am a smart person, I didn't fail, right? I'm still resilient, but you are questioning my ethics. You are making my job very complicated because you don't allow me to take decisions. You don't allow me to move a second here or there because your protocol, right? And suddenly I am a puppet of the system. And I don't know why you need me. You could have, anybody from school coming and doing what you say. So that moral injury is, I believe, the big problem, because what you were saying, this is not a question of money. I don't need a better salary.
I don't think so.
I don't need less hours. I'm okay with the hours that I work. I could work more if you treat me well. I just want you to respect me.
I love that, Miriam. And I have the word burnout. If you actually think about it, that implies what burns out, like light bulbs, machines, right? It goes like, even those words make you sound like a robot, right? I think I couldn't agree absolutely % on the moral injury. And I think, again, to be an optimist, we have all this AI and tech, and so maybe the robot helpers can crunch all the data and the numbers and the new research, and then the physician gets their little helper, and it's very easy to see, oh, hey, there's 5 new articles. I didn't know that. There's new research that maybe will help my patient. Oh, my robot helper just told me that maybe there's something I wasn't aware of. So again, we're all human. I can't read every medical article in the world. Like we're all human. So if we get the robot helpers, asking about what admin can do, every robot helper you give a physician or provider, what is it doing for them? Is it letting them be better humans? So I believe with physicians and healthcare, other workplaces, if the tech lets you be a better human in the room with that patient, then it's doing its job. So if we use our tech, if you think about purchases, investments of administrators, like what can I do to help? What can you do that will let that physician be a better human in the room with the patient? I also believe, just like Dr. Z, that, well, I'm a psychiatrist, so sometimes I don't even give medicine. Sometimes I just talk to people to make them better. I really believe that healing is at the core of what healthcare is about. And sometimes that's medicine, sometimes that's talking, sometimes that's a hug. So, the more that we can be better humans, like let the robots do the robot stuff, and whatever an administrator can do to let you be a better human, that has healing power that I believe the tech will never replace.
So what went wrong with tech when we had this thing called an EMR that was supposed to just empower the physicians? They were going to be able to spend more time on their patient. What happened? Because that's when I'm hearing technology, I'm hearing the same concern.
You will hear something very weird before I give you all the space, because I can tell that you will say something very different than what I will say. And you will be surprised about my comment. I personally, I love EMRs. I know that probably I am part of the minority. I grew up in Peru. I practiced medicine, writing papers that then I was not able to read because I was writing them so fast. And then trying to read the writing of others was even more difficult. And I will have these big chunks of paperwork and trying to see the hemoglobin of 10 years ago was absolutely a nightmare, and I will have to walk until the laboratory to get the results. So let me tell you, the EMR is wonderful in so many ways. The EMR is not wrong. It's the way that we are using it that is wrong. Now, all you, Jennie, needed to advocate for the.
No, that's kind of what I was getting at in the last little bit, was that if it's a robot helper and it's helping you be a better physician, a better human, then it's great. So if the EMR is cutting back on mistakes, if it's letting you have easy access on your phone to your notes, if it's, I can put in a prescription at home, I can I'm sitting on my deck, I can call in a prescription while I'm here at my house, or all those things, EMRs are wonderful. Where they're not wonderful is that, again, they originally were designed for billing and claims. So they were designed to be assembly line robots that cranked out codes, which went to the insurance and then got paid. So that's really where they originated. But I've built many EMR platforms for practices in the past, and I can tell you, when you do it right with the human in mind, it is helpful. So I had a practice for many years where I built all the templates, and I've consulted with EMRs, and I've seen it go good or bad. It comes really, it's like it's the mindset. Make the tech help the human, and it's wonderful. If the tech is doing other stuff, getting in the way of being human, it's going to drive the docs up the wall. And some docs complain about EMRs, but I have to say it is sometimes their mindset. Sometimes they have a block. Maybe they're angry at the system, and so they take out their anger on their notes. I'm not going to write that note. I'm so mad, and so sometimes it's
right.
Sometimes it's their mindset, right? And maybe they're not even aware of it. Maybe they're just subconsciously mad, and so it comes out on the EMR. Again, we're all human. We all do dumb, stupid human stuff. I have procrastinated many a note myself, even when I designed my own system, and it was wonderful. So I have done all the same stuff. I've gotten mad at my EMR. And what I've learned about myself is that if the EMR is well set up and I'm angry at something else.
Well, be careful. They're going to have empathy soon. The robots and AI will soon know how you feel.
Good.
We are like, this is just, we've sped through. You guys are just awesome. I mean, we've just covered so many topics. We're at like 10 minutes before we're like finished.
Oh my gosh.
And
just
so
got started.
the light, I know, I don't know if I go longer, I don't know if they'll shut us off. I don't know that. But I wanted to throw out what happens in our brains when we see emojis. Just wanted to have a little fun here.
Yes. This is a fun one, and I'll tell you the brain part, and then Miriam, you can.
Yeah, I will tell you
how you use
something.
them.
They make me feel happy in general, even if they are mean or they are rude or whatever. I don't know why my reaction is to laugh. In some way they relax me and they give me a break, and you will probably explain what happened in the brain, but for me it's a break of the, during the day. Give me like happiness.
I love that. That's if you're getting happy from the emojis, then the person is using them correctly. So that is awesome. The fun thing about emojis is most people don't know is when you look at an emoji of a human face with an expression that's a familiar facial expression, it activates the same cells in your brain that a real human face with the
I'm sorry. That makes me happy too.
Thank you.
So your brain actually.
Hi, everybody.
Hi. You recognize that the way you would looking at a human face. So when you see a smiley face, it's actually as if you're looking at a smiling face. And so as long as the basic emotions are pretty consistent across cultures, where it gets a little tricky are some of the more nuanced emojis, and people may interpret those differently. And then symbols, which are the non-faces, so the little, thumbs up or a strong, like all the different ones, those are basically a visual shorthand. And they get, we talked at the beginning about multitasking and like cognitive overload, and it actually gives you a little break. If you can have symbols without all the words, we're drowning in words these days. And so little symbols can actually give your mind a break, and they are shorthand, and they can express things in a shorthand way. They can also help with tone. So if you say the word, okay letters and then a thumbs up or a crying face or, the poop emoji, like it can express tone. And tone is another thing we really struggle with, especially in email.
I just want to interject because I don't want to say my age. It's not relevant, but I know the danger when I'm hearing with emojis, like my daughter, some of them mean totally different in the demographic or the cultural. I'm afraid right now in many ways to do emojis for that. That's the risk that I've been hearing. Is that true? Do you know the cultural implications with some of it, or?
Yep. So the key is that you agree on what the symbol means. So if there's confusion or disagreement about what the symbol means, then you probably should not use it. But if you work on a team and everyone on the team says, oh yeah, when I use this, it means this. Yeah, then use it with your team, and I work with a company. The thing I've done recently that I love the most about emojis is we have core values, and we created a symbol for each of the core values, and then we use it in our communication. So if we see a Slack message and somebody's demonstrating that value, we put the emoji, the symbol. And it's a shorthand, and it kind of reminds us of what's important. It reminds us of our values in this very kind of like subtle visual way. I love that. That's one of my favorite uses of symbols right now is how to communicate values in this like shorthand.
I love it. However, I want to agree with you regarding the young generation. I believe that, and I see it also with my kids. My kids are not at the age of communication, but I can imagine that soon they will be chatting and moving on with these two fingers. I need like 4 or 5 to do it. And emojis and some reductions of the words and are affecting the communication. It's a totally different way to communicate. And now that we have less human contact and everything is reduced to these 2 fingers, right? I don't know how this will affect the interaction and the emotion and interaction, in this young generation? What will happen with them when they grow up, when they go, to a work setting, and how they will type an email? I cannot imagine these kids that
They
are.
may not. I
Yes.
think they may not even use email. Honestly, I think the future of work is going to look pretty different than it does now. And by the time my kids, your kids, they're out there, that traditional office, I don't think you're going to, I already think it's disappearing now. Like it'll exist, but in some ways, but I think it's going to be total. I'm actually, again, I'm optimist. I'm very excited.
Do we want to get into?
Are savvy with this stuff,
I feel like you're getting into one of the questions about the traditional. Is that where you're getting with where the office came from and the office suite, or?
Yeah. So yeah, briefly. So what I call the traditional office, it's the conventions, 9 to 5. You all go to this building, you drive in your car, you commute, you dress a certain way. The boss has the big corner office, all of those conventions of the traditional office. And Dr. Z, did I tell you the story? You remember where it came from?
Oh, I remember something about how they were preparing. It was with cars, right? With the cars. I love the story, and how we are duplicating something that was created for cars and ensembling, and we are using it. I am a good student.
You are very good.
We are using. You know what? You explain it better, but. The story is so interesting because that explained exactly why it doesn't work for us.
Yeah, so briefly, it's the Ford factory floor, turn of the century, early 1900s America. It was actually seen as a more humane workforce than what the Industrial Revolution had before, where people worked all the time, women, children. So the Ford factory is considered very humane to make people work 9 to 5, Monday through Friday. And it was a factory floor. So the people, there was an assembly line in the middle, the workers lined up. He designed managers who could walk around the floor. Eventually, the managers got offices that rung the floor. As the company grew, they added floors. Pretty soon, the middle managers are here. The upper managers are here. You got your high rise and the corner office. And then what do you have in the middle? Typically, you have open floor plans or cubicles, basically replicating a factory floor assembly line. So what Miriam was saying, bottom line, why do you feel like a robot at work? Well, if you're in a traditional office, it came from the assembly line. So no surprise, but we just forgot. And we forgot that there were other ways of working. And, we parodied this. If you watched Office Space or that TV show, The Office, the British American, we were making fun of this years ago. We knew it was silly, but we just assumed it had to be that way. So my hope, and I think this is healthcare too, my personal view is the traditional hospital is going to be a relic pretty soon. I think within 10 years, it's actually going to look very different.
Yeah. I think I love what you with the Ford. Like he even tried to keep the cars like the 40-hour work week. I think came from Ford because he needed them to be able to drive their car that they could afford. So he had to make it affordable. I believe that's the part of it too. That's interesting.
Well, there was a concept of there was a guy named Taylor at the turn of the century. Taylorism was the idea of this kind of more humane 8-hour-a-day schedule. And he couldn't get it passed. He went to the governments to try to get it passed. Nobody would pass it. So it wasn't until Ford showed this dramatic success with treating workers better, which back then was better, then it became more widely used. And then you saw government programs or government recommendations on these kinds of work weeks.
Wow.
And now we are talking about the 4 days weeks, right? So who knows if in a couple of...
I think it's going to be totally different.
Yeah.
I think we've already seen, it was already happening. Pandemic accelerated it.
Yeah.
The next generation, I don't think they're going to want that traditional office. Most of them, I think it's going to look really different.
I can say in recruiting, as I'm a recruiter, man, everyone remote, I have to always ask that, is it hybrid? What does that mean? I mean, otherwise I'm wasting, between salary and requirements that I want to say the younger seem like it's this remote. But the other thing that I find interesting is there's a war going on, and I feel like it's the real estate holders such, I don't want to, the Jamie Dimons of the world that are really hesitant to get everyone out of the office because they have a lot of real estate holdings. I feel like
or the hospitals.
Yeah.
What about those giant buildings everybody built where you have filled with machines? And what if all of a sudden you're not going to use hospitals? I mean, that's a huge, hospitals are going under.
Yeah.
Yes, but you can change the perspective on healthcare, right? And use this as an opportunity for prevention, for gyms, I'm just creating ideas right now, but we will have to reinvent the use of these spaces, right? For something better than obligate people to drive. I just received a message from one of my ex-residents. She's now a hospitalist. And she was telling me, and I was not able to believe, that she needs to drive every day almost 2 hours.
Oh, yeah.
In the back and forth to work for 12 hours that day, or because the hospital is they have a different type of schedules, and then you go back to your house and you are a mom or you are a dad, and how this is affecting the well-being, because we work about certain things, we talk about certain things like if they are isolated, but the truth is that these go back. This is not just that you don't want to work there or you don't want to drive. This means that there's an amount of time and effort that is directed to do something that is not meaningful and that is resting from your time with family, from you to exercise or eat well or sleep well or do things that will allow you to perform better in your daily job. So there is a very tight connection between the look of the office or the time that you drive to the office and what happens with your performance. And we cannot separate that anymore. I believe that is very clear now.
We are at the hour, a little over the hour, and we did not get shut out. So we were thankful for technology allowing us to stay. We were having an amazing conversation. Dr. Jennie, Dr. Z, if there's one last giveaway or shout out that you would like to share with our audience, that would be awesome.
I mean, I would just say, the future of work is here. There's reason for optimism, but it does take a different mindset. And I believe the future of work is about being a better humanism. If you want to learn more about it, follow me on LinkedIn, Dr. Jennie Byrne, or check out my new book, Work Smart, which you can find on Amazon. But I love to connect with people on LinkedIn, so happy to connect with you.
And in my case, I want to say that I agree with Dr. Jennie. But I want to add something, that we need to start focusing in priorities. We need to know that we are not here just to work. And this is coming from a workaholic. So it's something that I am learning by myself, and that love, family, self-care, and many other things are important also, and that life is one and is short. So make sure that you enjoy your work, that you are in a good environment, that you are happy with what you're doing, but don't live to work, because that's not the real goal and the real priority in our lives.
Awesome. Well, thank you so much, Dr. Z and Dr. Jennie, coming on today and being our special guest, sharing all about well-being in the workplace and empower clinical teams.
Thank you, Michael. So fun to be with my friend, Dr. Z, as always, but great to meet you as well, Michael.
Awesome. Well, next week, we're going to have I've been saying doctor all day, but Lonnie Buchanan, and he has had many years of experience in IT, consulting with C-suite, and he's going to be talking about AI and some interesting technology implications and excitement for the future. So tune in next week. And until then, my friends, farewell. Have a great and awesome Thursday. Bye-bye.